More on this with global health policy expert Mario Ottiglio, who joins us from Geneva. Mario, good to have you with us. First of all, let's start with this concern that countries rushing to produce a vaccine are doing so for national interests. They're out for themselves rather than an urge to help the rest of the world. What do you say to that?
Good evening, and thank you for having me. Yes, politicians are anxious for good news. The general public, or at least part of this, is desperate for this magic solution to end the crisis. There are a couple of drivers right here. Of course, the countries will love to be able to claim credit because the first one to develop the vaccine will gain enormous prestige. But let's not forget that this is also not just population health, but is also, many experts are saying that a vaccine is vital in getting the economies back on track. So there is a lot of tension. And what we should avoid is political intervention in the coming months, ensuring that governments are able to keep actually quite fine balance between speed but also regulation. We are not seeing that everywhere, and some of the statements coming from the US and from other countries as well are kind of certifying that. Even in a less politically charged environment, like in many countries right now, in the world overall, there will be anyway a tense debate, right, on how much to accelerate the trials and the approval process. What is sure is that the longer the vaccines are tested before being released, the likelier they are actually going to be safer and effective. But, we saw that already with the H1N1. Many countries have already pre-ordered million doses. They have locked in deals with manufacturers without even knowing what's happening, and not necessarily, I think the first one is going to be the best one. Another last point is that, yes, of course, we should ensure that people have, according to an allocation plan, which really prioritizes people in need. But vaccinating everyone in one country will not keep that country safe, because this is a global problem.
So that's the question mark over how fast countries are going. What about access to all of these vaccines? The WHO, of course, has the COVAX program to try and make sure that all countries have access to it. Do you see that there's going to be barriers to trying to get any kind of effective vaccine distributed all over the world?
Absolutely. That's a concern, especially when you look into developing countries. On the positive side, we are seeing levels of partnership and collaboration that we have never seen before. When you look at the COVAX, when you look at what the WHO, the European Commission, a lot of heads of states are doing, or actually what Merkel and Macron have said recently, this is a good indication. The COVAX aims to distribute at least 2 billion doses of vaccine by the end of next year. And there will be a scheme where financing country will be able to kind of access the vaccine regardless of the ability to pay. And the financing countries will actually have enough to vaccinate 20% of the population. But yet there will be a lot of barriers, right? There will be some challenges when it comes, especially to the last mile. First of all, we have a vaccine, but we need mass production. We need vials, we need temperature controlled storage if that vaccine will be temperature sensitive. We need other materials. But then we also need efficient supply chains, in particular at the time of COVID, where actually transportation is hindered because of measures around quarantine and different blocks, right, between countries. There will be logistical challenges. We have learned once again from the H1N1 pandemics, where logistics, where legal agreements, where quality controls, they were all things that, of course, were very important to look at in order to facilitate distribution. In the case of H1N1, we also had a natural disaster, for instance. So there will be quite a lot of challenges on the way. And if I may, a last point on that is really the credibility. There is a lot of discussion worldwide around vaccines, and it will need to be very, very, very important to actually ensure good immunization campaign and credibility for the project that will be successful.
Mario, great to speak with you. Thank you very much indeed for that. Mario Ottiglio there. Now let's get some business news. Here's Oscar Sabacti.